All right, as we continue our look at the nervous system, what we want to do is actually take a look at the membranes that are involved within the central nervous system. So why do we have membranes? If we remember back to Unit 1, membranes are combinations of epithelial and connective tissue within the body, and that's what these are. The reasons why we have membranes is because our central nervous system tissue is delicate. In fact, you'll see when we dissect the brain that we have, what we'll actually do is kind of peel away some of the membrane, and we'll actually kind of tap on it with one of our instruments. And it's amazing the amount of damage that actually can take place from a simple act of tapping when you have the membrane removed. What it has to get protected from is things like the surrounding bone, because contact with the bone, whether it's in the skull or in the vertebral column, will cause damage. But you can't just simply isolate the central nervous system because it has very high metabolic demands. It needs a lot of oxygen, it needs a lot of nutrients, and therefore also needs some good waste removal. But by the same token, it has to be isolated from many of the blood components, so we need to kind of keep it separate. All of these needs are actually met by what we call the meninges, and these are 3 layers of membrane that surround the brain and the spinal cord. They also cover our cranial and our spinal nerves. So what we're going to do is we're going to go through those 3 layers and kind of talk about some of their components, and then we're going to do our diagram. The Dura Mater is the first one, and the way I remember this is because that prefix dura, I just think of durable, because the Dura Mater is tough and is fibrous. It is also the outermost layer. Now there is a little bit of difference in terms of the Dura Mater depending on where it is located, and you'll see what I mean when we go through it. In the brain and in the cranium, the outer layer of the Dura Mater is actually fused to the bone of the skull. So if you actually take off part of the skull, you're actually removing part of that membrane as well. It's fused together. Underneath this layer, there's a small gap that contains tissue, fluids, and blood vessels. And then the bottom is an inner membrane that forms these folds called dural folds that help to hold the brain in position like a seatbelt does. So because the outer layer is actually anchored and can't kind of swish around, it really helps those dural folds hold that brain in place. Now in the spinal cord, it's different. As you move, your spinal cord has to be able to slide within that vertebral cavity inside of the bones. So therefore the outer layer is not fused to the bone itself, because otherwise every time you twisted, moved, or did anything, you would actually tear that membrane, and that would be actually very painful. Instead, there is a space between the spinal cord, the outer layer of the Dura Mater, and the spinal cord. And if you remember from before, above, so it's above the Dura Mater, the prefix that means epi. This is what creates what we call the epidural space. It has loose connective tissues, blood vessel, and adipose tissue there. This is a very useful space. We use it for anesthetic injections that we call epidural blocks that create both sensory and motor paralysis depending on the type of anesthetic that is used. If you're having minor surgery in a particular area, let's say in your foot, you can actually have an epidural block instead of undergoing under general anesthesia, which in many cases is actually a better option. This type of epidural block is also the same kind of epidural that is used in labor and delivery. But nowadays, the epidural block that is used for labor and delivery does not include the motor paralysis part, simply because we do need the women who are giving birth to actually be able to control their muscles. They need to be able to give those motor commands. Now, at the Dura Mater, we can have 2 types of injuries, and they're basically the same thing. The only thing that is different is the location: an epidural hemorrhage or a subdural hemorrhage. In both cases, we have the leakage of blood either above the Dura Mater or below the Dura Mater. This is caused by severe head injury or severe head trauma, including concussions. What happens is as that blood leaks, it compresses and distorts our brain tissue, which impairs its functioning. In some cases, if this pressure is not relieved, it can actually create permanent damage to the brain. This is especially true if we end up with what's called an arterial hemorrhage. If the artery is damaged and is leaking blood, then because of the high pressure and the greater amount of blood that comes out, you actually get more severe distortion, and it happens a lot faster. You have to actually relieve that pressure a lot more quickly with an arterial damage or arterial hemorrhage. Underneath the Dura Mater is the arachnoid or the arachnoid mater. It is separated from the Dura Mater by a narrow subdural space that has lymphatic fluid in it to reduce friction. The arachnoid mater itself is a layer of squamous cells, and underneath or deep to this layer is the subarachnoid space. And if you think about the word arachnoid, obviously it's got to kind of do with something with spiders or webs, and this is where it comes into play. The subarachnoid space has that web of collagen and elastic fibers in combination with cerebrospinal fluid that acts as a shock absorber. The last layer of the meninges is the Pia Mater. The prefix Pia means delicate, so this is technically called the delicate layer. It is underneath the subarachnoid space, and it is actually bound, it's actually almost like vacuum shrink wrapped to the neural tissue. And you'll see this is the layer that we're going to actually need to peel away on the sheep brain, and it can be very, very difficult to do. The Pia Mater is characterized by blood vessels on its outer surface, and there's actually quite a lot of them. It is very vascular. So vascular refers to the amount of blood vessels, so it has a lot of them. And that's because our typical 3-pound brain uses as much oxygen as 62 pounds of skeletal muscle. And that's because, if you think about it, our brain can never be off. Not to be morbid, but if it's off, it's dead. You're dead. So, the skeletal muscle can relax and be off, but our brains can never be. So it has a lot of oxygen demands. It needs a lot of blood flow to the brain. And this brings us to our main disease of the meninges, which is called meningitis. Anytime you have the itis, it means inflammation of, and that's what meningitis is. It's inflammation of the meninges. Okay, and this is caused by a bacteria or a virus. When this inflammation happens, it can disrupt both the blood flow as well as the cerebrospinal fluid flow and supply. That leads to damage or death of the neurons and glial cells. Now, it sounds really bad. It is really bad. You don't want to get this. But the problem becomes that oftentimes we mistake the early symptoms for the flu, so we don't always get treatment as quickly as maybe we should. And for bacterial meningitis, that can actually be a fatal delay. Symptoms of meningitis include things like high fever, a severe headache, a stiff neck, difficulty rotating the neck, confusion, as well as vomiting. And you can see those are also very typical symptoms of the flu. The bacterial type, like I said before, is very dangerous. It can be fatal within just days. If you don't get treatment by about the 3rd day, you can be very much in trouble with bacterial meningitis. Fortunately, there's a couple of things that we can do. Number one, most of you should have had a Hib infection, vaccination. It's actually a series of 4 shots. Hib stands for no, it doesn't stand for hemophilia. It stands for Haemophilus influenza type B. So it's a type of flu, and we're actually vaccinated against that. And what that does, it prevents us from getting flu as a young child. Yeah, Haemophilus influenza type B. Basically what it does, that type of flu, it creates an opportunity for that meningitis bacteria, the meningococcal bacteria, to actually come into your system. And so by preventing that, especially when you're small and your immune system isn't very well developed and you can be very susceptible to that, it helps to keep the number of meningitis cases down. The other population that is very subjected to meningitis are college freshmen, because you live in what's called high density housing. A lot of people, small space. And you're together 24/7. If you're living in the dorms, when you're sick, you don't go home. you go to your bed in the dorm. And you tend to have a higher risk for bacterial meningitis simply because of the close quarters and how contagious the bacterial meningitis can be. It is recommended, and I think in many cases on certain college campuses required, that you get a meningococcal conjugate vaccine. And this is a conversation that you need to have with your doctor. Every year in the fall, there are stories of outbreaks on college campuses of bacterial meningitis, and they can be very scary, and they can also be very deadly. There's been some that have been just kind of a nuisance thing, but there's others that have been very, very frightening to the students that are involved. All right, the last thing here with the meninges that we want to do is actually take a look at the diagram here. So what we're going to do is we're going to actually color this in. So the first one I'm going to color in is the Dura Mater. The Dura Mater extends underneath the bone there, and because of the section that they actually took this out of, it actually looks like it's got more open spaces than it typically does. Each side comes together, and you can see here how it plunges down deep into that longitudinal fissure. Okay, that's one of those dural folds that we talked about. This next layer is the Arachnoid mater, and the Arachnoid mater is this one here. Underneath the Arachnoid mater is the subarachnoid space that I'm doing in yellow here, and this is where it actually gets that term arachnoid from. This is where that web is located. And then the last one in blue is the Pia Mater, and it is the layer that we have that's actually fused to the gray matter here of the cerebral cortex. So those are the meninges, and we will be continuing on then with talking about the spinal cord.